Hi, good morning, everyone. My name is Lisa Phillipson, and I am the Community Relations Director for Hospice of Southern Illinois. And I want to welcome you all to our fourth and final segment, and we hope that all of you have enjoyed surviving the Caregiver Conference. As she mentioned, I work for Hospice of Southern Illinois, and hospice care, which many of you probably know about or have heard of, or it's touched your life. I know that working in hospice care, some of the questions that we get oftentimes are, what does it look like? When does my loved one need hospice care? Well, hospice care comes into people's lives when the doctor has said that your loved one has probably 6 months or less to live. And remember something, that's not like an exact, like in concrete. There's definitely room around that, but that's just a guideline for that. And remember, we take care of patients no matter where they live. Hospice patients can live in your house, in a long term care, they can be in the hospital, they can be in a hotel, they can be in assisted living or memory care. So, hospice care, no matter where, takes care of folks no matter where they live. When you make that call to us, what you're going to receive very quickly is support and education. Our nurses are going to come out very quickly. They're going to talk to you. They're going to talk to your loved one. And remember something about hospice care. Yes, it's definitely about the patient, but it's also definitely as much about the loved ones taking care of him or her. Always remember that. Because when we come in, we're going to educate, let you know what's going on, what we see. You can ask questions. We don't move into your house, but we are on call 24 hours a day, no matter what day, no matter what time at 3 in the morning. If you need support, if you need answers, and if you need a visit, we will come. Hospice care will come in and talk and visit and make sure that you have everything you need. If that's equipment in your house, if that's the medicines that you need, because we're going to make sure, like you would go to a cancer, if you had cancer, you would go to an oncologist. Our expertise is in pain and suffering, and anything like that, we're going to take care of. We're going to make sure that your loved one is not in pain. That is our expertise. We don't want your loved one to die in pain, and we don't want you to die, that your loved one to die, and you not have that support going all the time. We're going to help with the medicines, the equipment. We're going to help with anything that you have going on as far as talking to you as far as pre-bereavement. We're going to make sure that if you need a volunteer to maybe call and support, we can help with that. But hospice care is about the whole person. It's not just the medical side. Remember that. So our social workers will come in, and if you've got a situation going on in the family and maybe some dynamics that you need some extra support with, our social workers will come in and help with that. We have bereavement staff that we stay in contact with families over a year if they need it. And like all the families on this call, some families need a lot of extra support and some families are doing okay. Some families are doing great and all of a sudden something happens and they need some extra support. So just remember that we're here and we're there for everyone. Hospice care will come in, and if you need the spiritual support, we're going to make sure that that happens. If you want to be in contact with a pastor, with a priest, with a rabbi, whatever your faith is, we're going to help coordinate that. Because maybe at the time in your life, maybe you haven't been able to attend church, maybe for some reason, and you don't have a direct care support like that. Our social work team and bereavement team will help you with that. Our nurses are going to tell you about the medicines they're choosing to help your loved one. They're going to make sure that if you need supplies, you're going to have them. They're going to take your call at 3 in the morning if you need it. Always remember with hospice care, it's definitely medical, but it's also support for you all the time. And I will tell you, things are a lot less intimidating when you know you can make a phone call to somebody and they can talk you through it. Or if they need to get in the car and come to your house, they're there for you. Hospice care has CNAs on our staff, and these CNAs help with daily living needs. I will tell you this, I think we all feel better even when we have the flu. We all feel better when we're able to be clean. Our CNAs come in and help with all that daily living, and they do it in a way that everybody keeps their dignity. You might have a situation where you want to try to help with your loved one, and maybe physically you just can't do it. Our CNAs will be on a schedule and they will help your loved one. And again, they will help provide that care, and they will always allow people to keep their dignity. What a gift. And for those that have a loved one that they're caring for, that you could be seeing the signs and conditions of dementia, some things that to look for that you might need to call hospice care if your loved one has dementia or Alzheimer's are the following. You might have decreased appetite, the inability to swallow, very difficult. They have progressive weight loss, frequent infections, urinary and pneumonia are typical ones. The inability to walk without assistance, the inability to bathe or dress self-independently, urinary or fecal incontinence, limited speech, increased behaviors and or confusion. Those are some of the things that you might see your loved one and they're changing a condition that you might want to call Hospice of Southern Illinois and have an evaluation done on your loved one. Because again, once that call is made and the doctor has said that they're in agreement, the equipment, the medicine, and the support are all coming with that. The other thing about this is with Hospice of Southern Illinois, our webpage is hospice.org. And on that webpage is an area called resources. And if you click on that, it will give you all the books that goes through all of these things about end-of-life care with different diagnoses. Again, that's hospice.org, and just click on the resource bar. We also have a phone app, and the phone app is Hospice of Southern Illinois. And again, in that phone app, it tells you the signs that you can see with all diagnoses, including Alzheimer's and dementia. All of those are included. Remember that when you're talking about Hospice of Southern Illinois, what I'm very proud of is we're celebrating our 40th anniversary. We are local, and we are your nonprofit hospice in the area. We've served this area longer than any other hospice program, and I'm very proud of that. When you're on hospice care, the majority of the time there's absolutely no cost affected with it. So you might, when you're talking to the nurse, you might want to ask about certain medicines, because always remember, we might have changes with medicines with your loved one, because when somebody is in hospice care, then the medicines oftentimes change because some medicines no longer are assisting that person. Remember that. And that's why they'll make those changes. But hospice care is about support. Hospice care is about caring for you and your loved one. And if you're already been caregiving for a long time, we can help you by allowing you going back to being the wife or the husband or the best friend. Because if we're doing our jobs right, we're going to be allowing you to be the spouse or the friend or the daughter or the son, not just the caregiver, because we're there to support with you. So remember to look for these things again: decreased appetite, limited speech, incontinence, either urinary or fecal, increased behaviors or confusion, the inability to walk with assistance, frequent infections, including and not limited to urinary or pneumonia, progressive weight loss, and decreased appetite. Those are just some of the things you might see with a dementia or Alzheimer's patient when it might be time to make a call to Hospice of Southern Illinois, just to see if it's time to get that extra support. So thank you so much for having me today. I'm Lisa Phillipson, Hospice of Southern Illinois. And if you need us, we're here And remember, we stay in contact with you for over a year if you need that extra support. Have a really nice day, and thank you again for joining us. I'm going to turn it over to Missy. Thank you, Missy.
Thank you, Lisa, for that presentation. Are there any questions for Lisa? If so, you can type those in that Q&A box. We'll just give you a few minutes or a second or two here. Okay, it doesn't look like there are any questions for you right now, Lisa, but if you have questions for Lisa after the presentations are finished, you can always call Hospice of Southern Illinois, or you can visit the website for more information.
Thanks, Miss.
Thank you. And my name is Missy Schmidtke, and I am the Information and Assistance Team Lead for AgeSmart Community Resources. AgeSmart Community Resources is the area agency on aging for the 7 southwestern Illinois counties of Bond, Clinton, Madison, Monroe, Randolph, St. Clair, and Washington. And our goal is to provide older adults the resources and information to maintain their health, be independent, and live well. Some of the services provided by AgeSmart, either directly or through our grantees, include assisted transportation, dining options, home delivered meals, residential repair and renovation, veterans directed care, information and assistance, senior health insurance counseling, which targets Medicare counseling, options counseling, legal assistance, the Senior Medicare Fraud Patrol, adult protective services, chronic disease self-management, a matter of balance fall prevention, services for caregivers, respite, services for grandparents raising grandchildren, and long-term care ombudsman. We also do benefits counseling, as AgeSmart is an aging and disability resource center that offers information and assistance and resource and referral services. Missy, Melanie, and April are the AgeSmart information and assistance staff and are happy to assist in providing resources for screening for benefit eligibility. If someone is eligible for a screened benefit, our information and assistance staff are ready to assist in completing applications for resources. But then I wanted to talk a little more about specific resources for caregivers. The first resource is the Elder Care Locator. The National Elder Care Locator allows you to search available resources in your community by zip code. It gives you contact information to the local and state area agencies on aging. It's also available if you're caring for an individual in another state, and you can access the Elder Care Locator either via their website, or you can call 800-677-1116. All of this information is on the AgeSmart website. There's also respite care. Sometimes a simple break from the caregiving role can help you, the caregiver, get a needed break. AgeSmart offers a respite program which pays the caregiver a monthly stipend they can use to purchase care, allowing them to get out of the house for a little while. Information about the respite program can be obtained at AgeSmart. You can call us at 618-222-2561. There's also caregiver counseling. Short-term counseling is available for St. Clair, Madison, and Bond County residents, and that's related to topics of aging, illness, grief, life events, caregiving, and community resources. The counselors are available for in the home of homebound individuals as well. And Madison and Bond County residents would contact Centerstone at 618-462-2331. And in St. Clair County, they would contact SWIC Programs and Services for Older Persons at 618-234-4410. Again, these phone numbers are available on our website. There's also a program called Savvy Caregiver, which I know St. John's is going to go into more detail about, but it's if you're caring for someone with Alzheimer's disease, Savvy Caregiver teaches basic knowledge, skills, and attitudes needed to handle the challenges of caring for someone with that disease. There's also stress busting for caregivers. The impact of stress on your health and its relationship to your caregiving is significant. Stress busting helps you deal with stress through relaxation techniques and problem solving. It can also teach you how to care for yourself while providing better care for your loved one. And I know that's also a program that St. John's is going to touch a little bit more in depth on. If you're living with a person with dementia, it can sometimes be difficult to get out and do simple things with your loved one, like going to dinner. Memory cafes can help with that aspect. You may be concerned about your loved one's behavior or abilities, and therefore you just stay home. Cafes provide a comfortable environment where you can meet with other caregivers and their loved ones and participate in activities. And St. John's is the information contact for that. I know they're going to speak to that as well. There's also legal services. Having your legal documents in order is very important. AgeSmart provides funding to Land of Lincoln Legal Assistance Foundation to assist with legal issues that caregivers face. And for more information, you can call Land of Lincoln Legal Aid at 618-398-0958. Again, all of these phone numbers will be on the AgeSmart website. We also have the Grandparents Raising Grandchildren program. In Illinois, more than 200,000 children are being raised in grandparent-headed homes. If you're one of these grandparents, there is help available. Assistance can range from financial assistance, guardianship, legal and information and assistance. And for more information, you would call the Children's Home and Aid Society. And then there is a new program that AgeSmart has recently started. It's called Tailored Care, or T-Care. T-Care is an evidence-based program that acknowledges the caregiver first. Family caregivers spend the most time caring for their loved ones, yet are the least supported member of the care team. T-Care is a mechanism for identifying strategies and services to assist the caregiver. How the program works: the assessment can be either initiated by the caregiver specialist or the caregiver. If you call our office and you speak to the caregiver specialist, they can do a short screening to see if you might benefit from additional services. Or a caregiver can go to agesmart.org and take the short form assessment. Once the assessment's completed, an email is sent to our home and community-based services manager, who will then link that to the caregiver specialist. The caregiver specialist will then identify intervention goals, strategies, and an initial list of resources. All of that is tailored to the caregiver needs, preferences, and availability. The caregiver specialist will meet with the caregiver to discuss findings and provide the caregiver with information for them to make an informed choice on which services they will utilize and how those services will help. And then they'll do a follow-up in 3-month intervals. And I just wanted to share my screen real quickly here to show where you would go on our website to look for that. So this is the AgeSmart website, and you would go to the services and then scroll down to caregiver support. And once you click on that, it pulls up the very first thing is the caregiver resource specialist, and where you can click to take the do the assessment link. And it's pretty self-explanatory from there. I just want to end with some advice that caregivers have given to help other caregivers. Ask for help. Don't try to do it all yourself. Trust your instincts. Most of the time, they will lead you in the right direction. Educate yourself on your loved one's condition. This will help you communicate with the doctors. And take a moment and just breathe. Caregiving is one of the hardest jobs that you can have. And just know that there are supports out there for you. And you can always call AgeSmart, contact us, and we are happy to provide those resources. And now I'm going to turn it over to Nancy Berry and Stacy Rhodes from St. John's Community Care for their portion of our presentation.
Thank you, Missy. Stacy, I'm Nancy Berry. I'm Executive Director of St. John's Community Care, and Stacy is our Adult Day Program Director, and so much more. She's going to start our part of the presentation.
Okay, good morning, everybody. Boy, isn't this a beautiful Saturday morning? And we thank you for joining us this morning for the short time today. So we're going to talk about all the programs at St. John's, but I am the director of the Adult Day programs. We have two of them, one in Collinsville and one in Edwardsville. We are the only Adult Day programs in Madison County, so that makes us the best Adult Day program in Madison County. So the purpose of our Adult Day program, any Adult Day program, is to have a safe and supportive environment. We also want to enhance the quality of life that the person with dementia has. You know, we have most of all, we have a fun and stimulating environment, because research tells us that we need mental, physical, and social stimulation to engage and enhance our brain. We all do. And I tell families that it's not good to sit at home, watch TV, and fall asleep. And what do they tell me? Oh my gosh, that's what my mom does. Well, we know that. So coming to the Adult Day program gives that stimulation. And so that's what we do best. Another goal that we have for our Adult Day program is to be a support to the caregiver. So the Adult Day program provides that respite that Missy was talking about. A time for you get a peace of mind that they're in a safe place, but also you can go do something for yourself. It's important for you to just go home and rest. Many people do that. Maybe you need to work. Maybe you need to go to the doctor, and it's easier to do that by yourself, or go shopping. But it's just a time that you can take a break and feel very comfortable that your loved one is safe, and very, very much I can say they're having a good time. So Nancy Berry is going to talk about our caregiver support services a little bit later, but I'm going to continue with our Adult Day because we serve anyone 18 years and older that has a chronic illness that can't stay home alone safely. So it's really important the safety is a big issue. And most of our participants are 60 years and older and with some type of dementia. Some have suffered a stroke. Some are Parkinson's disease, traumatic brain injury, and our mental health issues. So we have a variety of people that come to our center. We have walkers and we have wheelchairs, and people are very independent in their mobility. And we focus on people's abilities, not their disabilities. So that's a key there. The other thing, we are open Monday through Friday. Now, we just opened March 1st after being shut down for COVID. So during COVID, right now, we are open from 8 to 6 p.m., 8 o'clock in the morning, 6 p.m. But we're very flexible in those hours because we know that caregivers need that flexibility. So you just have to ask if you need some flexibility there. And we are limited right now to 13 participants a day at each center, so that until we get the okay from the state Illinois Department of Aging that we can increase, then that's where we're going to be. So we're filling those seats. We also start the day, so this is how it kind of goes. We start the day with cookies and coffee. So people are gathering in the morning, we're all kind of waking up, and I mean, what more do you want but besides cookies and coffee, right? And then we have a hot lunch at noon, and we have an afternoon snack. Both centers have a full-time nurse, an RN, on staff, and they administer medications if that's needed during the day that someone is there with us. They're going to do wellness monitoring by taking weights and blood pressure. And they're also going to communicate any changes they see to the families. So you can take it back and talk to your doctor about it. Transportation is sometimes definitely needed. Many families bring their loved one and pick them up, and that's fine. But transportation, we contract through the Madison County Transit Authority, and they have a door-to-door service, which is their ACT transportation. And then we also, in Collinsville, we're able to use the Collinsville shuttle, which is very helpful in transporting people in the Collinsville area. And in Edwardsville, we have utilized the Edwardsville and Glen Carbon senior transportation. So we'll help people set those services up as needed. So one of the most important things we do all day long is the activities, because that stimulation is so, so important. We have some things people always ask, what do you do? Well, we do cheer exercises. Bingo is always still a favorite. Crafts, we may do trivia, reminiscing. We have an art therapy program through SIUE. This is our 8th year. We've had an art therapy student in their art therapy and counseling program. And that is a valuable program. And she does individual sessions, and also she's done group sessions before. So, or whoever our therapist has been done group sessions. So we're going to play games. We play balloon volleyball, which is always that competitive spirit comes out in that balloon volleyball. We're going to watch the Cardinal games and be interactive with that. We're going to modify activities so our clients succeed. So we may take, a game like Scrabble, but we're going to modify it so they can succeed at Scrabble and have fun. So, so this is what we do. And pre-COVID, we had pet therapy and music therapy. So we hope to kind of get back to some of those programs once we are able to open up to volunteers and visitors. One of my favorite activities I wanted to say is Dance Party Friday. So we just put on the music and have a good time clapping, singing. And of course, if anybody can dance and get up and dance, we got them doing it. The other thing that we have in Collinsville is our courtyard. So we can do outside activities. And I know the Edwardsville staff is a little jealous of that courtyard because they do not have that amenity up there. So, but they do a lot of fun stuff up there too. The other thing, just to know, we celebrate everything because the whole idea is to have fun. So we take an idea, the whole idea is to have fun, to be engaged, to enjoy themselves. We don't force anybody to do anything they don't want to do. Families report back to us that their loved one eats better, they sleep better, they're in a better mood, they're talking more than they used to. So we see the benefit, and again, enhancing that quality of care. It makes such a difference. And when we were closed down during COVID, individuals who brought their families who brought their individuals back, immediately we had families say to us, my mom is talking more. My mom is doing so much better. So, so we have a lot of benefit from attending the Adult Day program. We also assist with toileting and eating as needed. Again, we focus on abilities. We're not going to do it for them. We want them to do it for themselves. When it comes to cost, we have a lot of payment sources that can be helpful. Our private pay rate is $12.50 an hour. And, but if you qualify for Veterans Services, they have a program that will pay for Adult Day. The Illinois Department on Aging has a program, it's called the Community Care Program, and that can help assist, and that's based on individuals' assets, not their income. And then also the Department of Rehab Services, the rehabilitation services for people who are under the age of 60. And then also we have managed care organizations, and they are for individuals who are on Medicaid. They are assigned a case manager to help them with managing their health care and also any support services such as ours. So if you're interested in the Adult Day program, you can always give us a call. I'll talk to you about your situation. We will also, we're giving tours at 7:30 in the morning and 5 o'clock in the evening during COVID. And we'd be glad to, talk to you about your loved one, because I can assure you that your loved one, people are hesitant to come to the Adult Day program. Oh, my mom won't like it. She won't participate. She always wants to be by me. Well, we know those techniques of how to keep them involved and engaged. And once they adjust to the program, sometimes they don't want to go home when you want to pick them up. So they trust us as staff. They got to get to that point where they trust us that they are going home. It's not a nursing home. They're not staying there. We show them there's no beds around. So once they trust us, they're having a wonderful time. So so if you're thinking about just a little bit, give us a call. And now Nancy is going to talk about our caregiver support services.
Okay, thank you, Stacy. I don't think she missed anything important, but know that all that information is also on our website, which is stjohnscc.org. And you're going to get all these phone numbers and websites in the mail because AgeSmart's going to mail you something after this, sometime in the next week or two. But the one thing I do want to emphasize is the adult day makes such a difference in both the lives of the person coming to us and the lives of the caregivers. On our website, you'll see lots of, testimonials of people who experienced that. So I encourage you to go to, if you're thinking at all about adult day, please call Stacy, go to the website, pursue that. Okay, I'm going to talk about our caregiver support programs because we know that without you caregivers, our folks would not be able to stay at home. They would probably be in a nursing home. And we also know that being a caregiver is exhausting, challenging, frustrating, and also rewarding. Depends a lot on the dynamics. It's different for everybody, but it's a challenge. Right now, our caregiver support programs are primarily virtual. We do have the ability to do some in kind of a hybrid mode. So it's both virtual or somebody can come into the conference room to do it. But they are worth your while. Savvy Caregiver, which Missy referred to, is funded through an AgeSmart grant. And it is a series of 6 classes. They're each 2 hours. We do them once a week on Thursday mornings. And it teaches a caregiver about dementia and focuses on how to do strategies to improve your caregiving, to deal with those problems that just seem like you can't solve them, and also to take care of the caregiver himself or herself. They're free to you. So just call the office to sign up. And we have one starting in May. A companion program is called Stress Busting. You don't have to take both, but Stress Busting focuses completely on the caregiver and how the caregiver can deal with his or her stress. And it must be fun. I have not sat through it, but Stacy's a master trainer and 2 of our other staff members lead the stress busting classes. And it actually goes through doing various activities. So you can find something that's going to work for you. Stacy just started a virtual program called Coffee Talks with Caregivers. And it's exactly what it sounds like. It is virtual, but it is an hour or so where you as a caregiver are online with some of the St. John's staff and talking. There is a structure to it that includes some education and something fun. But if there's a conversation going, that is what the caregivers want. That's the direction it goes because we want to be very flexible to meet your needs. We also have support groups. Right now, they are only meeting virtually, but there is one on the second Tuesday of each month that is specific to Alzheimer's and dementia. There's a second one on the second Wednesday of each month that is for any caregiver. And many caregivers are there because of dementia, but it is not exclusive to that. If you've not been to a support group, I urge you to give it a try. Doesn't cost you anything. You don't have to leave home. You just let us know you want to be invited and you'll get a Zoom link. You might be surprised, I think you will be surprised at how much better you feel being in a group where the other people know what you're going through, where they have comparable experiences and frustrations, where they can tell you, yep, what you're feeling is normal. You can say, I'm angry with my mother, if that's what you're feeling, and nobody's going to judge that because they know what's going on. And they are confidential. So if you do say I'm angry with my mother, the other person on there is not going to call your neighbor and tell them that. People have always respected the confidentiality of those groups. So I encourage you to try any or all of those. And again, information on our website, and you'll be getting information in the mail. Now back to Stacy, who's going to talk about our early memory loss programs.
Okay, thanks, Nancy. So anyway, we developed some early memory loss programs because there really was not anything around this area for that stage of dementia. So one of the programs that we have developed is Brainwave. And Brainwave, we've been executing that program for about 4 years. And it's developed to assist those with mild cognitive impairment. They've had a recent diagnosis. maybe early stage dementia. You do not have to have a diagnosis at all. That's not required. But it's for individuals who, to qualify, you have to be kind of aware of your memory changes that are happening in your life. Maybe you've talked to a doctor, maybe you haven't. Be willing to talk about those changes and how they're affecting you and you're experiencing. We do also pre and post assessments to determine the outcomes of the program. And the assessments are on cognition, depression, and anxiety. So we do that pre and post. And what we have found is that if someone, cognition that may change a little bit, not much, may go higher, 1 or 2 points. The other thing is the depression. If someone comes in and they are very depressed, that depression scale goes down, that's what we want it to do. And then also anxiety. If they have high anxiety, it comes down, sometimes a lot, sometimes just a little. But the whole point of the program is to do those things. But what we find is self-confidence is built. And that is reported by the client themselves and also by their family member. So those are the outcomes that we've seen so far. It does meet 2 times a week for 10 weeks. And we've chosen a Wednesday and a Friday. We've done this at 8:30 in the morning till 12 noon. So that seems to work real well. We keep it a small group. So it's 6 to 8 people. And we do meet face-to-face with this program. And we meet in Collinsville. That's the other part of this. And they don't meet in the adult day program at all. It's completely separate. And it's on the campus of our St. John's United Church of Christ. It's in the Faith Hall. So it's a completely separate meeting source. Now there's a curriculum that we use for this. And this is out of the University of Wisconsin. And so it's based on that curriculum. So during the 10 weeks, we educate the individuals about the disease. And also it's a support for them. And each attendee, I say, is in the same boat. They're in similar situations. They're experiencing similar things. So they talk about it and very openly. And so that's what we want. We want them to be able to feel comfortable of learning about the illness, and so they can relate to other people also. And that quality of life is really good too. I mean, we want to enhance that. So we incorporate also in this program physical exercise and balance, because what we do physically is going to affect us mentally, and what we do mentally affects us physically. So we incorporate a holistic approach. And we do brain games and exercises to, train that brain. And they get a memory tip of the day. And we talk about the memory tip of the day. And we review the memory tips because they give one each class. And they go home with a notebook and the exercises and activities that we've done, and can share it with family members if they choose. So we are forming a class here soon. So if you're interested or have somebody interested, please give us a call. Now, the other program that we have, Missy referred to, is our memory cafes. And we started the memory cafes back in September of 2019, before COVID. So they were face-to-face. And we met at different senior centers throughout Madison County. And currently, we're doing them virtually through Zoom 3 times a month. And Gail Shaw is the leader of that. And she does a great job of engaging people through Zoom, because that can be difficult. The other thing, so memory cafes are, social gatherings for people living with dementia and their care partner. So it can be a family member, a daughter or a wife. It can be a paid caregiver. It can be a neighbor. Anyone who is, we want them to come together, because that's the whole idea of having an activity that they can do together and succeed at again. And be involved in the community still, and have that supportive environment of other people that are experiencing the same thing they are. There is no cost to these programs. I didn't tell you there's a cost to Brainwave. Sorry. I'll go back to Brainwave a minute, because it is a cost of $500 for the 20 sessions, which is the 10 weeks. So, and we can talk about that if you have issues with that. the theme of, we have a theme for memory cafes. And we started, the first one was baseball, because it was baseball season back in, September of 2019. And we did one on yoga. Gail has talked about traveling through Route 66, holiday themes. They did a craft at Christmas time. And of course, they're singing the Christmas carols and enjoying the camaraderie. The whole idea is to have topics of reminiscing, learning, and enjoying each other's company, and just we laugh and have fun. It's just a wonderful hour of someone's time. And families tell us that it's a highlight of of what they can do together. Sometimes they're struggling with trying to find those things. What can we do together? And this is something they can do and really enjoy themselves. So if you're interested in any of our programs, look at our website. Look at the information that that is given to you through AgeSmart when they send it to you, and call our office, because we'd be glad to talk to you about any of our programs. So Nancy is going to continue with some of our other programs at St. John's.
Thank you, Stacy. And I just want to throw in there, if you're concerned about a cost, if you think maybe Brainwave would be great for the person you're caring for, or you want to come to the adult day, but you're not sure you qualify for the other programs, call us. We could usually find a way to make sure it's affordable to you. The rest of our programs, thanks to grants, we don't have to charge you anything. So do call us. And also, if you didn't already pick up on this, a lot of the things we do end up being fun for whoever's participating. We know that most caregivers don't have enough fun in their lives because they're really overwhelmed with or consumed by their caregiving. So give yourself credit and know that you need more fun in your life, and we can help with that. I've just got some odds and ends that didn't fit in other categories. We do loan small medical equipment, and it is a loan. You don't have to, there is no cost to it, and you can keep the medical equipment as long as you need it. We do not have big things like hospital beds or electric wheelchairs, but we do have walkers, bath benches, shower chairs, commodes, and usually we have a lot of incontinence supplies that people have donated to us. Most of these items have been donated to us. So if any of those things would make life easier, again, call the office to see if we have what you need. And we'll also hook you up with Adaptive Equipment, who gave the presentation 2 weeks ago, because they have great videos showing you how to use some of this equipment. So that's something that we have available between 9 o'clock and 4:30 each weekday to pick it up. We also have some Grand Pads to loan. Grand Pads are specialized tablets that are simplified to be easy to use for us older folks. We have a limited number, but we would be happy to loan it to you. Are obviously online, so you have a device. But if the person you're caring for, or a neighbor, or someone doesn't have a device that they can get online, that they can participate in things, especially if they might benefit from any of St. John's virtual programs, please be in touch. And one of our staff members will work with them and train them and be sure they know how to use it, and check up with them and see if it's working out for them. I do want to go back to something that Missy mentioned, and that is the caregiver counseling that's available in 3 counties here. This is not through St. John's, it is through other agencies, but the caregiver counselors in our area are excellent people. They understand what caregivers are going through. They understand dementia, they know about all the resources, and they can come to the person's home. Or if you're in a situation where you're caring for someone and you don't want to talk about their situation in front of them, they will meet you someplace else, they'll arrange it. And they can really help you through your individual situation. So I encourage you to consider that. And again, thanks to funding through various grants and the mental health boards, there's no cost to you. So the bottom line here is there's lots of help out here. We're trying to help you find it. And if we're the right place, we'll give it to you. If we're not the right place, we'll refer you on someplace else. So Missy, back to you.
Thank you both for all that wonderful information. There are so many great things happening at St. John's. I just want to remind everyone that if you have any questions for the three of us, you can type those in that Q&A box. And we just have a few things to wrap up with. Please complete the surveys that are being sent out for each session. Their recording for each of the sessions is going to be available on our websites or the YouTube channels. So if you missed a session or you got in late and want to watch the entirety of the session, you can go either to our websites or to the YouTube channels. We do hope you'll join us in 2022 when we'll be back in person, we hope. AgeSmart is going to be mailing everyone some resources like Nancy mentioned. The first one is this book. It's called You Are Not Alone. And then we will also be mailing brochures from St. John's, from AgeSmart, and from Hospice of Southern Illinois. So if we mentioned resources, our websites, the phone numbers, all of those are going to be on those brochures. Let me check real quick here. We actually don't have any questions in the Q&A. So I want to thank everybody for attending, and please feel free to contact us, reach out if there are any questions that you have when we end the session, or if you just want more information about one of those programs. And I'm going to go ahead and end the session now. Thank you, everyone.